Welcome to today's press briefing in relation to tobacco control and the current situation of smoking in Hong Kong. We welcome speakers. Secretary for Food and Health, Professor Sophia Chan, Director of Health, Dr. Ronald Lam, and Head of the Tobacco and Alcohol Control Office, Dr. Feng Ying. The Secretary will first speak, and then the other speakers will talk about the relevant area of the work before answering questions. Secretary, good morning, everyone. Today we have to announce a survey published by the Census and Statistics Department named a Thematic Household Survey Report number 75 on pattern of smoking. The findings of the survey show that in 2021, the number of people who smoke cigarettes every day accounts for about 9.5% of the population in Hong Kong. If you refer to this diagram, well, in 1985, the smoking rate was 23.3%. We've been carrying out our tobacco control efforts. We see a decreasing trend. The latest figure is 9.5%, which is a new low. And it is also, for the first time on record, that we have reached a single-digit figure. Compared to 10.2% in 2019, you see there is a drop. As I said, it is for the first time on record that the number has dropped to a single-digit figure. The survey findings also show that in the past decade, smoking rate among teenagers has been dropping and stay at a very low level. That's thanks to the hard work of everyone, including our Tobacco and Alcohol Control Office. This has marked a milestone in our work. In relation to alternative smoking products, the survey shows that those who smoke e-cigarettes every day accounts for about 0.3% of our population. It's higher than the rate in 2019. The findings also show that smoking rate among secondary school students has seen a marked increase. But when it comes to heated tobacco products, the smoking rate among the population has not changed. We're happy to see that the smoking rate among cigarette smokers has dropped since early 1980s from 23.3% to 9.5% in 2021. This shows that our initiatives, including legislation, taxation, law enforcement, education, and smoking cessation services, have achieved considerable effects with support from different quarters. In relation to alternative smoking products, although the number of smokers in Hong Kong remains at a low level, but we notice that the number has increased compared to our last survey. Considering the harm brought by alternative smoking products to our public health, we do need to take determined action to prevent these products from taking root in Hong Kong. We hope that with the Smoking Public Health Amendment Ordinance 2021 coming into effect, we will be able to drive down the number of people smoking alternative smoking products. Law enforcement departments will continue to collect intelligence as well as to monitor the situation under the ordinance. If there is any irregularity or illegal activity spotted, or if they've received any complaints, there will be swift action taken. And I appeal to members of the public not to break the law. And I'd also like to talk about the road ahead for the government in this area. Notwithstanding the low level of smokers in Hong Kong and the fact that the rate is one of the lowest in the world, smoking is still one of one of the major preventable causes of death. We all know that smoking harms your health. Local and overseas studies show that smoking can cause a number of chronic illnesses as well as cancer. This will also cause premature death. In turn, this puts huge pressure on our healthcare system. There is a need for us to drive down the smoking rate further. You may recall a report that we have is titled Towards 2025 Strategy and Action Plan to Prevent and Control Non-Communicable Diseases in Hong Kong. In this report, it says that by 2025 we have to lower our smoking rate to 7.8%. There is still a long way to go. The report by the Census and Statistics Department is of great help to us in mapping out the way forward. Dr. Feng Ying of the Tobacco and Alcohol Control Office will give you more information about the report. In terms of smoking cessation services, the Department of Health has launched the Quit Month for June in order to promote smoking-free lives. Dr. Ronald Lam of the Department of Health will give you more information shortly. Number of government departments and non-governmental departments will also work together. Take the Transport Department as an example. In order to raise the awareness of professional drivers in relation to smoking-free lives and in order to encourage them to quit, starting from June, the Transport Department will, first of all, through trade associations of taxis and newsletters of the taxi trade, organize various activities to promote smoking-free lives. On top of that, the department has also launched the Safe Driving and Health campaign as one of its key area of work. Apart from that, our clinics as well as our district health centers will also launch various activities to help more smokers to quit. And it's not just about June. Dr. Lam will give you more information. We appeal to the public to quit. Members of the public may go to these locations to seek help. Of course, in the long term, we want to eradicate the harm brought by tobacco products. We will launch a plan for an end game. We have drawn reference from different jurisdictions. We will launch various strategies and formulate a timetable and roadmap for an end game. The end game will be a smoke-free Hong Kong. And I will share with you the general directions of our work. Of course, first of all, in order to reduce the risk exposure of the public to secondhand smoke, we will consider how to expand the ban on smoking in public areas and how to more effectively implement relevant legislation. The report of the Census and Statistics Department said that there are over 60% of the respondents who agree to the expansion of a non-smoking area to the waiting area of transportation. This is one of the areas we may consider. Looking around us in different places, there are places such as Singapore, Beijing, and Macau that has put in place a more stringent strategy. In these places, they have venue managers to implement relevant regulations. In some countries or areas, they designate all public areas as non-smoking areas. They only allow smoking to take place in private places or few public locations. The second area we need to consider is to lower the appeal of tobacco products. If we are to further lower the rate, and if we are to reach a target of 7.8% in 2025, or even to reach our end game, we do need to do more. There are two prongs that we need to take forward. First, to stop non-smokers from becoming smokers. That's why we have to lower the appeal of tobacco products. And those who are already smokers, we will help them quit. So in relation to these two areas, we have to try to lower the appeal of tobacco products. The report of the department says that amongst those who smoke cigarettes, they prefer original flavor. However, when it comes to the younger age group or women, there are more people who smoke menthol or fruit flavor cigarettes. We will carry out studies in relation to this phenomenon. The fact is that there are different countries and areas that have adopted a more vigorous policy on packaging, sales, flavor on tobacco products in order to make them more effective. Say, for example, they have imposed ban on products with added flavor, banning of display of tobacco products at sales outlets, as well as the requirement of plain packaging. The third area we need to work on is to draw reference from the experience of other places in order to stop a younger generation from taking up the habit. In recent years, countries like the US and Singapore has enhanced the legal age of purchase of tobacco products. In New Zealand, they plan to legislate to ban youngsters who were born after 2008 from purchasing tobacco products in a legal way. We will take reference of these initiatives before deciding on our own. We're still working on different plans to reach the end game. Our initial plan is that we will consult the public before the end of this government. We will provide a roadmap and a timetable in order to garner more public support. I will now hand over the floor to the Department of Health for further details.
Dr. Fung, good morning. I will give you the details of the outcome of the survey report. For this thematic household survey report, it is about the pattern of smoking. We started this since the 1980s. We carried it out once every 2 years. So it is households-based. About 10,000 households were interviewed. It was in the form of a face-to-face questionnaire survey to collect the data. The latest one took place in the middle of last year, covering people who were aged 15 or above in Hong Kong. For the outcome of the survey this time, we can see that for the preference rate, it means that for people who smoke daily and those aged 15 or above, that's the preference rate. Last year, it was 10.2%. It dropped to 9.5%. I mean, the year before last. So there was a reduction of 56,400 for daily preference. It means that people could smoke every day, except for special reasons like having fallen ill. Now, let's take a look of the preference of daily smokers by types of tobacco product. From this slide, you can take a look that the daily preference rate is 9.8%, covering all types of tobacco product. The mainstream products would be cigarettes, between 2019 and 2021. Well, in 2019, 97 out of 100 smoked cigarettes, and then 2% heated tobacco products, 1.1% e-cigarettes. For other products, the percentage is too low for it to be sort of marked. So the majority of the smokers took cigarettes. From this chart, you can look at the trend over the years. For the red line, it indicates the population aged above 15, and you can see that it is a downward trend. For the one marked in blue, that's the young preference rate, aged between 15 and 19. Like what happened in the previous year, we saw that as a result of the small number of samples, we were not able to project the preference rate for the overall population. For 2 years in a row, we saw this phenomenon, so we believe that it must have come down to a very low level. And then the preference rate by sex for those who are male, in fact, the rate has been falling all the time. Last time, 18.1%. Now it is 16.7%. Unfortunately, for the female preference rate, it remains at about 3%. Last time it was 3.2%. This time 3.0%. But then, statistically, it is not a significant difference. This table, you can take a look of the change in smoking preference between the 2 years by age and sex. First of all, for the overall rate, those in the age band of 40 to 49 and 50 to 59, we have a very high preference rate, 14.2% and 11.7% respectively. For male, throughout the different age bands, we have seen a significant decrease. 20 to 29, 40 to 49 are the two age groups that show the same result as we had last time. So statistically, there hasn't been any significant change, but still we can see that there isn't a significant decrease. For the male preference rate, well, they account for the majority of the smokers in Hong Kong. So when you look at the overall rate, you can see that for most of the age groups, we have seen a decrease. Next, let's take a look of the age distribution of the smokers. Just now, the highest number of people smoking would be in the age groups of 40 to 49, 50 to 59. Now, for those in the age group 50 to 59, we have the highest number here. In other words, about half of the smokers are age 50 or above, and then 1/4 of them could be found in the age band of 40 to 49. So for the remaining 1/4, they are aged 40 or below. In other words, most of the smokers are middle-aged or elderly. For the daily consumption of cigarettes, well, in fact, this is an indicator, a very important indicator of nicotine dependence. For the daily consumption rate, for those who smoke daily, it is 12.7 sticks, so the same as the result last time. In our report, we have also got a chart to tell you that the majority of the smokers would take 10 sticks a day, so it has remained more or less the same for many years. In other words, even though we have fewer people smoking, but then the daily consumption rate hasn't changed much. Well, on this occasion, this is the first time that we try to understand the flavor of the first cigarette smoked by current cigarette smokers. From this one, you can see that we have the distribution by sex. That is the first time that they smoke cigarettes. We want to find out about the flavor. Blue indicating the preference of male, and pink female. 57% of the female smokers preferred menthol for their first cigarette, but then for male smokers, they mainly go after the ordinary or the original tobacco flavor. If we look at the situation by age group, you can see that the younger the smoker, the more likely that for the first cigarette it is menthol. In other words, for the more elderly smokers, when they first smoked, they smoked ordinary or original tobacco, but nowadays younger smokers would usually start with a menthol cigarette. And then for the current flavors in fashion, 63% of the smokers go after the original flavor, but then over 30%, almost 40% will have menthol or other flavors. We also asked about fruit as well as spices, but then other than the original flavor, most of them would choose menthol.
In relation to the flavors currently used by smokers, for males, over 70% of them prefer the original flavor, and for 70% of the females, they will use either menthol or fruit flavor. In relation to age groups, we can see that most of those between 20 and 29 and 30 and 39 age groups, current smokers use menthol cigarettes. So when we look at the age group 40 compared to those in their 20s or in their 30s, we can see that over half of them are smoking menthol cigarettes. So younger smokers, most of them smoke menthol cigarettes. Regarding alternative smoking products, we mainly look at heated tobacco products and e-cigarettes. This year, for heated tobacco products, we see a marked increase this year. That may be the case, but it's at a low level, 0.3%. Still, this is an area of concern. We do hope to drive the number down. In relation to heated tobacco products, we see a drop. But we find that there is no significant difference statistically. For smoke cessation, we look at the awareness of cessation services or methods. We see that 76.9% of the population are aware of the services and methods. And the ways they've used to quit, most of them rely on their own will. For people who use cessation services or medication, the percentage is rather low. Current smokers, do they want to quit? We see that about 30% of smokers have tried to quit. The remaining 68.5% who have never tried to quit, we see that half of them have not seriously considered quitting. About 40% of them That is about 29% of the entire smokers population. They do not want to quit. We plan to involve healthcare professionals in our cessation services, so we have collected some baseline information. In our survey, we find that in the past 12 months, before the survey time, number of people who have been in contact with healthcare professionals and they've been asked about their smoking status, we see that about 27.8% of them have been asked about their smoking status. We also see that the majority of people think that healthcare professionals should ask about their smoking status. In relation to exposure to secondhand smoke, in the survey we have covered public places where one may be exposed to secondhand smoke. As expected, at pedestrian walkways, entrances of buildings, and waiting areas of public transportation, there is a higher exposure to secondhand smoke. We've asked our respondents where they think should be covered by non-smoking areas. The highest percentage are transportation waiting areas. Please note that the second last item, all public areas, is on the list. So there may be changes in the percentage of respondents who support expanding non-smoking areas to all places. We've also covered schools. It's done by the School of Public Health of the Hong Kong U. It covers 141 schools and about 40,000 students. It's done by questionnaire. We look at 3 areas: cigarettes, e-cigarettes, and heated tobacco products. For cigarettes, we look at the current smoking rate. It means that in the past 30 days, they have smoked. We see that, for those in primary school, primary 4 to primary 6, there is no marked change. The figure is an increase by 0.1%, but statistically, we don't consider that a change. For secondary school students, similar to the last one, there is no significant change statistically, but we do see a clear decreasing trend. In relation to e-cigarettes, those among primary 4 to 6 students, there is no change. Last time it was 0.2, this time it's 0.3, but statistically we don't consider that a change. For heated tobacco products amongst primary students, there is no change. It's 0.2. The figure itself has changed, but statistically we don't consider that a change. Among secondary school students, it's different. We see that for heated tobacco products, it's changed from 0.5 to 0.3, which is a drop. For e-cigarettes among secondary students, we see a marked increase. So for this survey covering schools, we see that for e-cigarettes there is an increase, and heated tobacco product there is a drop. I'll now defer to Dr. Ronald Lam about our cessation service as well as the Quit Month campaign. In order to reduce the harm and fatality caused by tobacco products, we have always been implementing a multi-pronged approach covering law enforcement and promotion of smoking cessation services. I will now give you an update in these two areas. In relation to legislation and enforcement on alternative smoking products, there are mainly two pieces of legislation. The first one is Smoking Public Health Amendment Ordinance 2021. It took effect on the 30th of April. It prohibits the import, promotion, manufacture, sale, and possession for commercial purposes of alternative smoking products. The other one is the Pharmacy and Poisons Regulations. Well, this is in relation to the regulation and prohibition of sale and possession of unregistered pharmaceutical products or Part 1 poisons. Nicotine is under Part 1 poison. For alternative smoking products, it covers tobacco-based e-cigarettes, as well as heated tobacco products. In relation to the Smoking Public Health Amendment Ordinance, which took effect on the 30th of April, we have mounted large-scale enforcement actions. Prior to the ordinance coming into effect, we have sent out inspectors to 230 retail outlets that sells alternative smoking products. We saw that about 54 of these outlets were selling alternative smoking products. Our inspectors at that time issued advices to urge them to stop the sale of such products after the legislation comes into effect. And after the 30th of April, we went to these places. We did not see any breach.
For our second operation on the 4th of May, as well as the 24th of May, we went to 3 places in Mongkok and Yunnan where we suspected that there were the sale of illegal products. It's a joint operation, and we found 100 devices for e-cigarettes and also 6,000 boxes of nicotine-containing cartridges, and 7 men were arrested. They were suspected to have in possession and sale of Part 1 poison. And then we would like to enforce the import ban. Our control office dealt with more than 30 cases of travelers bringing alternative smoking products of them when they entered Hong Kong. There were also 3 other cases involving mail packages. Investigation is still ongoing. When there is sufficient evidence, we'll take out prosecution action. And fourthly, as you know, that the law says that nobody can use alternative smoking products in the non-smoking areas. Between January and April this year, the inspectors of the control office within the NSAs issued more than 40 fixed penalty tickets. We'll continue to inspect such statutory non-smoking areas to make sure that the smoking ban will be observed by the citizens. I'm most grateful to the police as well as the customs for their ongoing support in our tobacco control work. We'll continue with our close cooperation. We'll collect information and intelligence, and we'll deal with the complaints so as to take action against the people who breach the laws. So that's more or less what we have been doing since the introduction of the amendment to our Smoking Public Health Ordinance. Next, we would like to talk about our efforts to echo the World Tobacco Control Day on the 31st of May. We have designated June as the Quit Month, and we are going to launch a large number of activities so as to encourage smokers to make quit attempts. And will encourage and promote the use of cessation services and aids. Now, targeting at different groups of smokers, like the female, elders, etc., will have different health themes. For the elderly, we'll say that it is never too late to quit. As soon as you start quitting, for the first 20 months, your pulse and your blood pressure will go back to the normal level. In a year's time, the risk of having cardiovascular diseases will be halved when compared to smokers. So it's never too late to quit. For the female smokers, we will emphasize the benefits of quitting. Say, for example, when you smoke, your skin will not be as good, and it will bring about premature menopause. And there will be female-related cancers like the cervical cancer. And then for the parents, we say that you should quit for the sake of your children, so as to reduce the exposure to second-hand or third-hand smoke. And then we have been subventing the relevant clinics. We have the Tongwa Group of Hospital Cessation Center, as well as the United Christian National Community Health Service. There will be a 1-week NRT trial pack. So if you want to quit the habit, you can visit the clinics yourself, or you can make an online appointment, or you can call our hotline 1-833-183 so as to have an initial assessment, and then you will be able to get a 1-week supply of the NRT trial packet so as to ease the withdrawal symptoms. And then in terms of the social media, we will make use of our Facebook page. We will be putting up daily posts about the benefits of quitting. And we are grateful to a number of ex-smokers. They have helped us. We are putting together 4 short videos, and they will be published soon. Like a smoker got the laryngeal cancer, another one bladder cancer, and then the benefits of quitting to the health of the children, and then the advantage of preventing chronic obstructive pulmonary disease. So 4 of them will tell their stories, their testimonials. And then 28% of those interviewed in our survey told us that when they consulted doctors or health professionals, were asked about the smoking status, while for the rest, that is 70% of them, were not asked about their smoking status. We see room for improvement. As Dr. Fung has said, 70% of those interviewed in fact agreed that the health professionals should ask about their smoking status so as to provide advice. So we would like to support the healthcare professionals so that they can support and help people to quit. So there is a science-based publicity kit. It is a very brief advice and brief intervention on smoking cessation. Such information kits will be distributed to different healthcare professionals so that they can help the citizens to quit smoking and get treatment. The Hong Kong U has also kindly helped us. There is an online training course for both the general public as well as the healthcare professionals, and that's what I have just referred to. That is, it's a training course on very brief advice and brief intervention on smoking cessation. For the very brief advice, well, in fact, it will only take a healthcare professional 30 seconds to tell the patient or people seeking advice about effective ways to promote quitting. And then I want to take this opportunity to inform you that for the past 5 years, we have been focusing on a number of themes, and we have yielded results. For the use of cessation services for our hotline, for the past 5 years on average, we handled between 6,000 and 9,000 inquiries. For the HA, again, they have got many clinics providing cessation services. For new cases for the past 5 years, the average was 12,000 up to 19,000 new cases. That's the volume that they have handled. And then, as I have said, we have partnership with many NGOs as well as other charitable organizations so as to have prevention and cessation services. I'm grateful to the Tongwa Group of Hospitals for the cessation service, and for Port Oil Hospital for acupuncture, and Lok Shin Tong, they have also got services for the staff, and then for usage necessary for the ethnic minorities, another one for new arrivals, and then for PolyU, they have a quick line for the young people. So we have got a few major projects in total for the past 5 years. 35,000 times of help have been provided. We have also got the cooperation from the life education, and again for 140,000 sessions have been provided. The transport department, the hospital authority, among other government departments, have been helping us in our tobacco control efforts. Now, I want to remind the public that while we are still suffering from the COVID-19 onslaught, we cannot forget the prevalence of the smoking hazards. And in fact, every year we are losing 7 million lives to smoking hazards. And then for COVID-19, the latest information shows that smokers, when compared with non-smokers, it is more likely that they will have a very serious case. The difference is 50% or more. So let's hope that smokers will take the opportunity to quit ASAP. In year 2025, we would like to drive the preference rate down to 7.8%. So it is a tall order for us. As the Secretary has said, we are going to step up our efforts on all fronts. Let's hope that tobacco harm on us will be minimized as much as possible. Thank you.
Thank you, Dr. Lam. The floor is now open for questions. Reporters, please use the microphone we give you, identify your media outlet, and limit your questions to under 2. The lady on the 4th row. I'm from Hong Kong 01. I'd like to ask some questions. The objective is that it should reach 7.8% by 2025, and we still have about 2 or 3 years. Currently, it's 9.5%. The year-on-year drop is not sufficient to reach that target. So what's your assessment of our chance of success to reach that objective? Is it the case that tobacco control measures will be more and more stringent? The Secretary shared with us information of 3 major areas to reach the end game. You'd mentioned about drawing reference from overseas regulations, say for example, ban on adding flavors, enhancing the legal age. What are the measures that you have put in place? Say for example, the venue manager accountability. How is it going to be done? Can you share with us information about upcoming measures in the pipeline? I will first answer your questions. The current smoking rate, according to the latest survey, is a single digit, 9.5%. We have imposed a ban on heated tobacco products as well as e-cigarettes. But still, we saw a marked increase. We've started our work after the 30th of April. We hope to see a decreasing number of people using alternative smoking products. For the prevalence rate, currently at 9.5%, whether we can reach 7.8% by 2025, and what ways we can use to reach that target. In the long run, I mentioned about the 3 major areas for the end game. Regardless of measures or policies, if we are to drive the smoking rate down, there are 2 ways. First, to stop non-smokers from becoming smokers. We need to reduce the incentive to smoke. We also need measures to dampen the appeal of tobacco products. We may need to legislate. We need to get the public to understand the hazards brought by smoking. Apart from stopping people from becoming smokers, amongst smokers that numbered 580,000, we need to get them to quit. According to our survey data, respondents who've been asked whether they have considered quitting, we don't see a very satisfactory number. About 50 to 60% of them have not considered quitting, or they say that they won't quit. Of the 60%, 30% of them have tried but failed. So for those who have failed, we need to find ways to help them succeed. Smoking is addictive, and that is something that we need to deal with. In the Quit Month campaign for June, we will distribute free of charge nicotine replacement treatment. For those who do not want to quit, the 60%, how are we going to reach them? Every year, we have a publicity campaign, but how do we make it sustainable? But what about those who have just not considered it, without meaning to not quit? We have to make it convenient for them. Our experience shows that there are lots of people, it's not the case that they don't want to quit, it's just an idea that's never occurred to them. And in our relevant units, we have launched various publicity campaigns, and also in relation to our district health centers, we have various services available that are readily available to them if smokers want to quit. So we need to make it convenient. Say, for example, the Tonghua groups of hospitals, they have a mobile center in the form of a vehicle that will circulate Hong Kong. For patients who are discharged, if they want to quit, they can approach the relevant smoking cessation unit of the hospital authority. As to how we can reach 7.8%, we do need a multi-pronged approach. I mentioned about that end game and the 3 areas. We need to address the problems of secondhand smoke, which harms your health. It's supported by a lot of studies. It's not the case that we can ignore second-hand or third-hand smoke because they are not as harmful. Smokers may choose to smoke, but people around them may not have the choice when they inhale second-hand smoke, and they're affected. We have heard the voice for an expansion of non-smoking areas, say for example, waiting areas at bus stops. People are not happy about being forced to inhale second-hand smoke when they're just waiting for the bus. So we need to consider about possible expansion of no smoking areas at various public places. If you make it inconvenient for smokers, they may want to quit. And that's something that we learned from previous smokers. There are also other areas, say for example, how we expand our cessation service. There are also other ways, legislation, taxation, publicity campaign, provision of more cessation service locations. There are many ways for us to reach the 7.8% by 2025. The general direction of the no smoking endgame is important. We need to send a clear message to everyone that this is the path the government's going to take. Next.
Thank you. This is James with Transit Jam. So you're talking about, you've actually floated the idea of a complete public ban, which is bolder than expected. But even the ban at, say, the bus stops, how would that be enforced? Because enforcement at the moment is pretty poor, and you will see even bus drivers and bus captains smoking at PTIs at the moment, where smoking is supposed to be banned. And you see smoking in NTR toilets, for example, and on footbridges all over town. So if you can't enforce that, then how would you enforce a complete public ban? Second question, every 7-Eleven and tobacco stall and Circle K in town has illegal tobacco advertising within it. And it have, not only that, they also have cigarettes at child eye height. They have posters, which they're not supposed to have, and colourful devices, which they're not supposed to have. This has been raised to TACO about 4 years ago. I haven't seen any movement on that. I haven't seen those taken, and it's a systemic problem across the city. So I'm just wondering if that's something that you could address in your last few weeks of this government. Thank you.
Thank you. Thank you for your question. First of all, your question about the complete ban and also the some of the current situation of people smoking. Obviously, there are, you mentioned about some drivers smoking, and also perhaps there are also other people who are smoking or smoking on the streets. We are determined and also decided to have a complete ban, or really, if we are going towards the end game situation, the smoking prevalence, we would try our very best to push it down. But of course, it may not go down to zero. If we look at the experience of overseas countries, more or less, they would push it down to about 5% or below. That would be the end game timetable and also major direction. If we are looking at the bus stops or expanding the non-smoking area in the community at large, I think it is important, for us to limit, the space that people can smoke, not to restrict, the right of the smokers and so on, but really to protect people who are non-smokers. I think this is very important. Of course, for smokers, we want them to quit smoking, and not only we use the June as the quit smoking month, but also there are other smoking cessation spots in the community that the Department of Health have sponsored, that the government have started, the district health centers and also district health center express to help people stop smoking, and also the hospital authority, obviously. So we'll do our best to encourage these people to quit smoking. That's number one. And number two, I think if we do not have a plan and if we do not have a timetable, really, everybody may not be very clear about what the government is going to do. So with this plan of having an end game, overall strategy and also plan, it would make everybody very clear, about our direction and also our targets to meet in the coming future. As far as the enforcement of some of the illegal display that is concerned, at the convenience stores, as you have highlighted, perhaps I can invite Dr. Fong to give some figures and updates.
Yes, thank you for your question. Actually, we've been stepping up our enforcement against those displays of tobacco advertisement at the retail points. In the past year, we've been taking prosecution against over 100 cases, and there are a dozen cases that have been convicted, but the many cases are still in the legal proceedings. But we are taking action to curb the tobacco advertising at retail points.
下一位，嗰邊第三項詳。
The next reporter, the gentleman in the third row. Good morning. I'm from Hong Kong Economic Journal. Well, in relation to the use of e-cigarettes, for the past couple of years, we have got 10,000 more. So what is your analysis? What about secondary school students? It seems more of them are taking e-cigarettes. Quite a significant increase. Are you worried? Well, the ban only came into effect in April this year. So for those who have been using e-cigarettes, as a result of the ban, are you worried that there will be a relapse to traditional cigarettes? And then earlier on, Professor Yuen Kok Yung said that summer this year would be the golden opportunity to allow us to go back to normalcy. Are you going to do that? Are you worried that in winter the pandemic will worsen, and then monkeypox is quite prevalent in a growing number of countries? Are we going to do anything about it? This is about smoking cessation, so we will take questions concerning tobacco control for the pandemic as well as the case of monkeypox. We'll deal with them later. So first of all, Secretary, about tobacco control. Thank you. First of all, e-cigarettes. Of course, we are concerned and we are worried. And exactly because of this reason, since we have got the Public Health Smoking Amendment Ordinance 2020, we are able to ban heated tobacco products as well as e-cigarettes. As to whether we're worried that by giving up e-cigarettes and heated tobacco products, people will then switch over to conventional cigarettes. Well, we do have some figures for those who are on e-cigarettes as well as the heated tobacco cigarettes. Many of them are already smoking cigarettes. It is usually a case of dual use. I think Dr. Fong can bear me out on this regard. Of course, their health will be harmed if they use conventional cigarettes. So we will crack down on the sale of e-cigarettes as well as the heated products, and will continue to publicize the harmful effects of e-cigarettes as well as the heated tobacco products. We'll invite the different partners helping us to help people to quit smoking. We will ask them to emphasize not just quitting cigarettes, but also the alternative smoking products. This is to prevent people relapsing. Of course, we understand that for citizens, if they are interested to quit smoking, whether e-cigarettes, alternative products, or the conventional products, I think it is now the best opportunity. The fourth row, the lady reporter wearing spectacles.
So How confident is the authority in achieving a reduction of smoking rates from 9.5% to 7.8% within just 3 years? Would the authority consider setting a more aggressive target? And the second question is, what are the other tobacco control policies that the authorities are now considering? Like what places might be listed as non-smoking areas, and will you consider a universal ban on the alternative tobacco products? Yes, thank you.
Thank you. Thank you for your question. First of all, obviously we have now hit a single digit. That shows that our tobacco control efforts has been effective. And our targets of 2025 meeting the target of 7.5, obviously that is going to be a challenge, especially when our smoking prevalence is so low. But then we are determined to use all our comprehensive strategies, multi-pronged strategies, in order to further decrease the smoking cessation, decrease the smoking prevalence. I think in order to do that, when we are considering our strategies, there are two major directions. One is we have to prevent non-smokers from become smokers. So that's why we would need to further protect our young people, our women, and also people who may be attracted to smoking, not to be attracted. I think this is one very important direction. Secondly, is for us to further cut down the number of smokers now. And how do we do that? Is that to help them quit smoking. So riding on these two directions, if it is successful and if our policies and measures are successful, the smoking prevalence will go down. So our strategies and our methods and our resources would be put in these few areas. Of course, as I've said, in having a timetable and also a clear direction about the tobacco end game, this would give everybody a clear direction and also a strategy to follow, so that we are all clear that by a certain year, the smoking prevalence of Hong Kong, we are determined to further cut it down. And if we look at these three directions that I have earlier talked about, first, of course, is the issue of secondhand smoke. Secondhand smoke is something that we worry a lot, because secondhand smoke also causes diseases, cancer, and also death. So this is something that many of our researchers, global research and also local research, have already shown. So we are determined to consider expanding the non-smoking areas in Hong Kong. So right now, of course, we have a way to do it, every year. But then I think we have to do it faster and also broader in terms of the coverage. So we are thinking along, that direction. And secondly, of course, we are also looking at experiences from other countries, so that we understand more how other people, can do it, and also putting responsibility to the operators or the responsible owners of places where there should be no smoking. Throughout the years, we receive a lot of complaints about, for example, people smoking while waiting for the bus, and also people smoking, on footbridges and so on, or people smoking in very, very busy areas, in the community. So I think we would look at all these different complaints and also situations, so to determine, how we are going to do it. Secondly, of course, we have to decrease, as I've said earlier, the attraction of tobacco products, to people. And the findings that we have highlighted, for example, the selection of some flavors, in smoking would actually attract, people, especially young people and also women, as we can, understand from our research findings. So whether we need to ban these flavors and how to do it, we will further consider. And also the product itself, for example, the pictorial warning, the packaging of the products. Sometimes all these may also attract people's attention and also their intention to buy the product. So again, we would also look into how these are done. And of course, the display, as one of the reporters have also talked about, is also something that would attract people. So some countries have actually banned, display of tobacco products. So therefore, we would also look into these, direction. And of course, plain packaging, the package of the cigarettes. And of course, the third, direction that we are also thinking is that we need to stop, tobacco's harm, to our next generation. And so therefore, again, looking at the experiences of other countries, and actually many places have already done it. For example, the US, Singapore have already done it. They have raised the age of people who can legally purchase a cigarette. So Hong Kong is 18. So there is, of course, room to do that, to increase the age of people legally can purchase cigarette. And for example, New Zealand, has further done work that people who are born in a certain year, that they would not be allowed to buy cigarettes anymore. So again, these overseas experience, we would, look into, we would consider and see whether Hong Kong, whether it suits Hong Kong and how Hong Kong should do it, along this direction. Of course, we would need more research, that is tobacco control related research, so that, especially local research, so that we would understand whether our policies, existing policies and measures are effective, and how we should further strengthen or amend, such policies. Thank you.
Sorry, the speaker's not using a microphone. What about e-cigarettes? Sorry, the speaker is not using a microphone. We have noticed that the advertising, marketing of e-cigarettes at locations where youngsters frequent. Before the legislation came into effect, we do notice that youngsters might be attracted to electronic products. Youngsters naturally are attracted to electronic products, and they may be subject to peer influence. So when e-cigarettes are marketed at places where youngsters frequent, on top of that, e-cigarettes are affordable. Youngsters are not very aware of the hazards brought by e-cigarettes. Some e-cigarettes contain nicotine, and in Hong Kong, any products containing nicotine will have to be registered. So there is a chance that these products have broken the law. And if these products contain nicotine, youngsters, after consumption, may be addicted. We do hope that with the ordinance having taken effect, we do hope that these issues will be addressed and the smoking rate will continue to decline. We will take further questions before the Secretary may answer questions about the epidemic as well as monkeypox. The lady over there. I'm from Ming Pao. The roadmap of the end game. Which year will it be? When will you be able to issue the roadmap? If you can't reach 7.8% by 2025, how do you ensure that your plan will come to fruition after that? Within the coming few years, will you introduce legislative amendments to ensure that 7.8% can be achieved? I'd like to also ask about electronic cigarettes. We searched on the internet and found posts on sale of e-cigarettes. Do you have any information about youngsters using electronic platforms or internet to buy e-cigarettes? Will you take actions against sales of e-cigarettes online? I'll answer your first few questions and then I will defer to Dr. Lam or the Tobacco Control Office on enforcement. Our survey shows that currently the smoking rate is 9.5%, which is a record low. That's done through everyone's efforts. As a number of people have mentioned, we have a target set in 2025 in order to prevent non-communicable diseases. The target we set for smoking is 7.8%. We have a two-pronged approach. One is to stop people becoming smokers and the other one is to get smokers to quit. We have been working on our initiatives. We have 85% of the packaging showing warnings. It was increased from 50%. And we have a complete ban on heated tobacco products and e-cigarettes. Dr. Lam has already gone over our tobacco control work, and we have been increasing our funding in this regard. These are things that are ongoing. On top of that, we need more effective and targeted measures. The three major areas to reach an end game are based on our preliminary studies. We think that these areas will be conducive to our work. In relation to taxation as well as cessation services, we will continue to take them up. For the roadmap and timetable to reach an end game, we plan to give you the information within this year. We do need to first do studies to see whether Hong Kong has the favorable conditions for these measures. We will launch public consultation on the end game. We do understand that there are measures implemented by overseas jurisdictions, and we need to consider Hong Kong's situation. From now to 2025, we still need to take up a number of measures. There is information and findings from the survey, and it's helpful to our work. In relation to second-hand smoke, we find that a lot of people are exposed to second-hand smoke, and that is harmful to their health. Over 60% of the respondents support the expansion of non-smoking areas. It gives us the confidence to take forward our work. We also see that when people go to see a doctor, go to the hospital, they would talk to healthcare professionals. But they're not about but they're not asked about their smoking habits every single time, only about 30% of the time when they were asked. The general public trust healthcare professionals, and they would heed the advice from healthcare professionals. If these professionals ask about their smoking habits when they see a patient, if we distribute information kit via healthcare professionals, and if there are more and more healthcare institutions and organizations that participate in our cessation service, if more professionals ask questions about smoking habits, this will be of help to reach the 7.8%. For other areas, say for example, devotion of resources, legislative changes, we will continue with our work. Thank you. Dr. Lam. Sale of alternative smoking products is also an area of concern of ours. If one purchases alternative smoking products from overseas sellers via the internet, then the sellers are considered an importer of alternative smoking products, which is a contravention of the law. Together with customs, we would check parcels. If we find alternative smoking products, we will be informed for follow-up actions. Some people may make use of the internet to buy alternative smoking products locally. We'll monitor the situation. If need be, we will take action. We may do test purchase, and we may mount operations with the police or Customs and Excise Department to combat such illegal activities. We'll now hear from the Secretary about the epidemic as well as the situation in summer from Professor Yoon as well as monkeypox. I will first answer. If need be, Dr. Lam will supplement. If you look at the epidemic situation in the past few weeks, you realize that it's rather stable. The daily number of cases is around 200 to 300, and for a number of days it's dropped below 200. This is a stable situation, but at the same time we do notice the existence of transmission chains in the community. We will not let our guard down. The CHB Center for Health Protection will continue with their work. Apart from looking at the daily infection cases number, we will also look at information gathered from mobile sample collection stations as well as community testing centers. We'll look at the percentage of positive cases. Every day there are about 60,000 tests, and the percentage of positive cases is about 0.1, 0.2 cases, 0.2%, which is rather low. The average is below 0.5, although there is a daily fluctuation. Another indicator we will look at is outbreaks at certain locations. With face-to-face classes resumption in April, students will do RAT every day. We have not identified any clusters, save and except a recent case of a kindergarten. We have not identified any outbreak in a particular secondary or primary school. The CHB will closely monitor the situation. Social distancing measures have been relaxed. We will monitor the situation. We do notice an increase in activities. At some restaurants, there are clusters. And in some restaurants, the ventilation system is not ideal. The FEHD will continue to carry out inspections. We ask restaurants to make sure that the ventilation system is working well, because people will take their masks off when they eat. In relation to clusters, you will hear more from Dr. Lam. The contact tracing office is carrying out contact tracing work. We now have a vaccine pass. We'll be able to swiftly carry out contact tracing work. We also monitor the situation in care homes for the elderly. Residents and staff members have to do RAT daily. They will make reports to the CHP every day. We have not identified any increasing trend. Another indicator is the sewage surveillance program. And indicators by the Hong Kong U, we monitor the situation every day. We see that all these indicators are dropping. As to whether our healthcare system is affected, we look at the daily admission rate, death rate, number of serious condition cases. We see that all these numbers are dropping. All these show that with a large number of people having been infected and having recovered, the situation is rather stable, although we do see a few hundreds of infection cases. Vaccination will create a protective barrier. So is an infection. So we will have a dual barrier of protection. We will not let our guard down. Our work, the work of the CHP, are being enhanced. We make preparations for any potential outbreak or a significant rebound. Our healthcare system, isolation beds, manpower will react swiftly to any possible rebound. We are prepared. We have been doing drills. Another equally important area is prevention of imported cases. You heard me talk about testing, isolation in relation to prevention of spread locally. Well, you will hear more from Dr. Lam about prevention of imported cases, spread of variants, and whether these variants are more transmissible. Whether the variants has any impact on our vaccines. You'll hear more from Dr. Lam. So our work continue. We will closely monitor variants. If these variants enter our community, and if these variants are more transmissible, it will have an impact on the epidemic situation. We've been doing very well. And the questions you've asked, you will hear more from Dr. Lam about monkeypox. We are also very concerned about this. We see that there are cases in overseas countries and places, but not in Hong Kong. But we will not let our guard down. We are prepared. We have a contingency plan. It covers different areas. First, identification of monkeypox cases. The Public Health Laboratory Service of the CHB has the capability to identify these cases. There are tests. The CHP has sent letters to all medical practitioners to draw their attention to this. If they identify any patients of monkeypox, they will refer these cases to the Department of Health. Well, the reporter asked about vaccines and medication to treat these cases. We are making preparations. The Department of Health and the Hospital Authority are working on it. They are working on medication and vaccines. We'll hear from Dr. Lam. Should we have a monkeypox case? As to whether there will be isolation or relevant measures, the Department of Health is now working on a plan. The plan will consider overall data and the overall situation. We will first conduct risk assessment. We are aware of the risk, but it's a low risk. We won't say that there is no risk because we see cases in other places. We'll closely monitor the situation. Now I defer to Dr. Lam.
Thank you. There are two main points concerning the pandemic, and then I will talk about the monkeypox. Of course, experts have been saying that with the onset of summer, perhaps we can further relax the measures. It depends on whether the infection remains stable. We are entering the season of summer. A few indicators here. First of all, during the pandemic of COVID-19, I think you can see that even for countries in, say, for example, Africa, where the temperature is high, they still suffer from the onslaught of the virus. So it is not true to say that with summer the risk will be gone altogether. This is not the case. Second, we have to look at our prevention and control measures, and we'll have to see whether new variants may emerge in other places. If that is to happen, I'm afraid this will bring about another peak in the number of cases. So we need to have the preventive measures in place before we can say categorically as to whether we can still keep the caseload stable. Another point is that, bearing that in mind, we see that the daily number of cases is controlled at the level of 200 to 300 a day for the past week. Now, in the month of May, that's what we got, and therefore we have resumed case tracing and tracking. Like close contacts have to be quarantined, and we are tracing down the relevant places. And in May, we have at least 10 clusters. It is important for us to have case tracing so that we can identify the transmission links, and then we can swiftly put in place isolation as well as quarantine measures, and then we can suffer the transmission links, and then we can suppress the spread in the community. In relation to our efforts to guard against importation of cases, well, we know that the risk lies in the following. We have variants locally we are also worried as to whether there will be new variants coming into Hong Kong. For all arrivals that are tested positive, we'll carry out a full genome sequencing, and then we can identify whether there are subtypes or whether there are other variants, and then we want to know whether the pressure is increasing. That's what we have been doing, and of course at the same time we have a very strict control, and an arriving traveler must have a negative result of a PCR test, and then upon arrival they have to undergo the test and hold arrangement. In relation to the risk posed by monkeypox, first of all, let's take a look at the mode of transmission. First of all, it is a zoonotic disease that both human beings and animals may suffer from it. The main route of infection is coming into contact with infected animals, infected human beings, or contaminated articles. Through contact, you may get the disease, and then if you have been together with an infected person and without the right preventive measures in place, and then if there is a prolonged face-to-face contact, then you may get it by respiratory droplets. As far as our infection control is concerned, vaccine is of course important, but then early detection, early isolation would also be important. Well, this is quite unlike the case of COVID-19. You know that for COVID-19, and at least in the case of Omicron variants, a large number of the infected persons do not show any symptoms. But then in the case of monkeypox, patients will have fever, very bad muscular pain and headaches, etc. So symptoms are quite visible. So by identifying the symptoms, we can then isolate the patients, and then we can trace the close contacts of the infected persons. So other than vaccines, such will be important tools of public health for us to prevent the spread. As far as the World Health Organization is concerned, it appears from information collected that there are certain high-risk groups like male sexual contacts. So perhaps there may be high-risk behavior with exchange of body fluids that would spread the disease. So we'll look at the risk groups, the infection, or the transmission mode, etc. We've looked at all such factors. It appears to us that unlike COVID-19, it appears that there won't be a very widespread infection. But still, having said that, we need to be on our guard, and we'll be very proactive. We'll liaise with the relevant pharmaceutical manufacturers. Early detection, early isolation, and proper treatment would also be important public health measures. Thank you, Dr. Lam. That's it for today's press conference. Thank you. The reporter didn't use the microphone. For the smallpox, it's only 80% effective. Well, for the vaccine against smallpox, it can also be used to prevent monkeypox, and then the effectiveness is 80% or more. Thank you.